Ladies and gentlemen, welcome to this new segment of Medcast, your gateway to the latest medical trends and updates. Today, we are so pleased to have again Dr. Nisreen AlMusaileem, who is a consultant in otolaryngology. Sinusitis is one of the most common problems we have in society, and today we are so pleased again to have Dr. Nisreen to discuss more about the sinusitis and the treatments available for this problem. Welcome, Dr. Nisreen.
Thank you, Dr. Ali.
We are so honored to have you again.
Thank you. Thank you for having me.
Dr. Nasreen, I think we had a very small discussion about the sinusitis before we get shooting this episode. So, could you please explain more about the sinusitis and why it's very common here in the society?
We have types of
Mm-hmm,
sinusitis. Like I can divide them to acute and chronic.
mm-hmm,
And acute, which is something like that happened in a less than 4 weeks
mm-hmm,
period, like and then resolved. And we have chronic that lasts more than 4 to 6 weeks, and it's prolonged.
mm-hmm,
And what we always encounter, like the common one is the viral one, that's acute sinusitis,
mm-hmm,
and it's usually caused by viruses. And the period of the infection or the disease, the disease is like 10 days, and it's usually having like bad symptoms for 4 days and then resolve gradually in the next 4 days.
mm-hmm.
And this type of sinusitis doesn't need any medication, any antibiotic, no need. It's a viral infection, and it can resolve by its own. All you need is symptomatic treatment, like pain,
Salines.
uh,
Mm-hmm,
saline rinses, um antipyretic, like something to lower the fever, lower the pain, like Panadol, NSAIDs, any ibuprofen or anything,
mm-hmm.
and something that decongest the nose. And decongestion is not by antihistamine, because you're a pharmacist, you
Yeah,
know that. Like the problem in and I teach the general practitioner and family medicine. They come to my clinic, and I teach them, and I love to teach them, and I always teach them that please don't use antihistamine as decongestant.
the consistency is very
Yeah,
different.
they're very
Yeah.
different. And please use systemic ones and don't use topical ones.
Mm-hmm,
Like you have the option of using systemic decongestant. So go to this option. It's always better for the patient to prevent other problems with topical one.
yeah.
And usually although it can cause like absence from work and absence from school, and like the clinical symptoms of acute sinusitis, which is headache, facial pain, runny nose, obstructed congested nose and throat, and a lot of secretions. And it's always a clinical diagnosis,
Mm-hmm,
and it can resolve by its own. The other type, which is bacterial, the bacterial ones is usually comes in a more severe symptoms, with fever, more severe symptoms, and it lasts longer.
mm-hmm.
So when you have these symptoms that last more than 4 days, and or it's more severe, then we consider having the bacterial one, which is bacterial sinusitis, acute. And at this time, we need to use antibiotic.
Mm-hmm.
And the other most important thing, use it for more than 7 days. 7 days is not enough. And that's the problem with bacterial sinusitis, acute bacterial sinusitis. And that we see it in special group of patients, like who has some sort of anatomical obstruction, so, or allergies. So those patients, they are prone to have acute sinusitis or recurrent acute sinusitis.
Which can stay longer than
Uh,
6 months, let's say.
and later on, if the problem seems to be chronic and last longer, and it's more recurrent, and the symptoms last longer than 6 weeks, more than 4 weeks or 6 weeks,
Mm-hmm.
then we consider that this is a case of a chronic sinusitis.
Then we can have decision for making advanced treatments, let's say.
Exactly.
Now, one of the problem with the people that are having sinusitis, they might also suffer from prolonged periods of migraine. Can be that true?
Um, they usually have facial pain and some headache because of facial pain,
Mm-hmm,
but it's not it. we can tell, like with history, we can tell the difference between the headache, like migraine headache, or other types of headache, like cluster headache, or tension headache. We have many types of headache
Mm-hmm.
that can be differentiated from sinusitis.
Mm-hmm.
And in those types of headache, you cannot have like the other symptoms of nasal congestion, runny nose, facial pain, and those specific signs and symptoms of sinusitis. And good history, good examination, you can differentiate between those.
That's great. Now, you know, the problem is with the especially with the migraine and the sinusitis, because some people might think that they must treat the migraine without going to find the underlying cause, which is the sinusitis. So that's why I have asked this question. Now, if the patient comes to your clinic and ask for diagnosis,
Mm.
is it like any certain test you would do for the patient to see if he's having sinusitis or not?
Yes, a patient with chronic,
Yeah,
for
with the chronic
example,
ones.
for example, chronic sinusitis, they will have clinical signs.
Mm-hmm.
We can check it on endoscope,
Mm-hmm.
and we can check it on imaging.
Mm-hmm.
Like we do CT sinus for those if we are suspecting
Mm-hmm.
a patient having sinusitis clinically. If they have some clinical signs of sinusitis clinically, we do imaging and to confirm the diagnosis, because we need to combine the clinical signs and symptoms with the imaging to give them the diagnosis of
Mm-hmm.
sinusitis.
So you firstly make the CT scan and then you would do the endoscopes.
No, I would do the endoscope in the clinic
Mm-hmm.
and examine the nose and check for signs of the clinical signs and symptoms. And then if I suspect that this patient have chronic sinusitis, then I would do a CT scan to have the big picture. Like we combine all the imaging and clinical finding to give them the diagnosis of chronic sinusitis. Otherwise, like there's a clear cut between diagnosis of headache,
Mm-hmm.
certain headache, and sinusitis.
No.
Like
Okay.
you can tell always.
Okay,
Yeah.
that's great. Now, if we go to the treatments, you have mentioned some preservative treatments such as the salines and the decongestants as a tablet or the systemic ones.
Yeah.
But some people might prefer using the local ones, such as the xylometazoline, which is very proudly used by the people we have in society. And some of them might use them for longer periods, like 4 years.
Mm.
As a specialist, would you recommend using xylometazoline for long periods?
Unfortunately, yes, that's very common,
Yeah.
and I
I was
always
afraid you were saying, unfortunately, yes, I advise. Sorry.
no,
Okay.
no. Yeah, it's like very common.
Yeah.
Like I always have like one or two patients in every clinic
Hmm.
who's using xylomethazone, Otrovin, whatever brand name,
Hmm.
and they think that they are getting relief,
Yeah.
but at your pharmacist and what's going on.
Mm.
The problem, it will cause something called rhinitis medicamentosa, and I avoid to prescribe it.
Mhm.
I only prescribe it for a patient to prevent bleeding post-op.
Mhm.
Like if I did some nasal surgery, if I'm suspecting that patient might have some bleed at home, I usually prescribe it to just to stop the bleeding if it happens,
Mhm.
or I use it just to in very uh, particular scenarios when it's in need.
Mhm.
Like I usually use it in a clinic to decongest the nose so I can examine
Mhm.
with endoscope. And otherwise, I don't. And in acute sinusitis, I do use systemic ones,
Mm.
not the topical ones.
Okay.
Yeah,
S-
and the problem it will cause, I told you, it's rhinitis medicamentosa.
Yeah. And somehow it may cause as well the relapse for the symptoms if they use it for the longer time. And I think it's medically advised to use it for no longer than 5 to 7 days. This is the maximum they can use it.
Yeah, I usually tell them 3 to 5 days,
Yeah, which is
actually.
better. So
Yes, yeah.
because some people might think this might cause addiction. It's not medical addiction rather than just addicting the habit they are doing because they are getting the instant relief
Yeah.
of the decongestions. Now, as a doctor, again, you might go with the endoscopes to examine the patients.
Mm.
Now, is there any difference between the traditional endoscopes and the advanced one?
Actually, it's the same in the scope,
Mm-hmm.
but um, we have like uh, stages of surgery.
Mm-hmm.
Like if we're doing surgery,
Mm-hmm.
we use the endoscope as like an advanced endoscopic sinus surgery to go beyond the sinus.
Mm-hmm.
Like sometimes we go beyond the skull base and beyond the sinuses, or like advanced sinus surgery,
Mm-hmm.
endoscopic sinus surgery. But it's the same endoscope. It's like this the specialties just advanced.
Okay.
Yeah.
So there's no much difference between
No, actually, it was introduced in the 90s, not so far from now, and it's introduced in the 90s in the States, and then it started with some problems and complications, but then we had this specific training, specific knowledge for this type of surgery, and now we have the navigation system,
Oh,
and
great.
and every department, ENT department in Kuwait, we have this navigation
Mm-hmm.
system, and it's very advanced. It's exactly map the sinus, map the skull, and you walk into the sinus like you're driving with a navigation system. And it's much easier. It's helped, especially if you want to go beyond and do advanced surgeries.
Hopefully, in the near future, you would also have artificial intelligence, which would make it more easier for you to work the diagnosis and the surgeries as well. Dr. Nasreen, we are so pleased to have you here again, and hopefully we can see you later.
Thank you so much, Dr. Ali. It was a pleasure.
Thank you so much.
And the honor is mine.
Thank you so much.
Thank you.
Our dear viewers, we have reached to the end of our segment today with Dr. Nisreen AlMusaileem. Hopefully, we can see you again with another medical specialist. Until that time, see you later.